So, you find an unconscious victim laying on the ground next to a table full of food. What should you check first? Are there any clues as to what happened? Who should you contact? Does anyone know first aid? What should you do?
I don't know. I wish I knew what to do.
Don't worry, when we are through you will know how to help save someone's life. And for everyone else watching this, remember the life that is saved could be your own.
So, Doc, what is CPR? I've heard a lot about it, but what is it and why is it important?
CPR has to do with people having cardiac arrest, also known as a heart attack. During cardiac arrest, there is no blood flow. Chest compressions create a small amount of blood flow to the vital organs such as the brain and heart. The more effective the chest compressions, the more blood flow is produced. Chest compressions that are too shallow or too slow, or chest compressions that are interrupted frequently, do not deliver as much blood flow to the brain and heart as effective chest compressions. Every time chest compressions are restarted following an interruption, the first few compressions are not as effective as later compressions. Frequent or prolonged interruptions in chest compressions decrease blood flow and the victim's chance of survival. To keep it simple, CPR provides a trickle of oxygenated blood to the brain and heart and keeps these organs alive.
In other words, cardiopulmonary resuscitation, CPR, serves as an artificial heartbeat and an artificial respirator until fibrillation can shock the heart into a normal rhythm or emergency equipment arrives.
Exactly. The first step of CPR is to assess the victim and check responsiveness. Gently shake the victim and shout, "Are you okay?" If the person answers, CPR is not needed. If the person is unresponsive or conscious and showing signs of a stroke or heart attack, call 911 immediately and initiate the ABCs of CPR.
Doc, what are the ABCs of CPR?
It is an easy way for you to remember what to do. Each letter stands for a step. A equals airway, clear the airway. Put the person on his or her back on a firm surface. Kneel next to the person's neck and shoulders. Open the person's airway using the head tilt chin lift. Put your palm on the person's forehead and gently push down. Then with the other hand, gently lift the chin forward to open the airway. Check for normal breathing, taking no more than 10 seconds, look for chest motion, listen for breath sounds, and feel for the person's breath on your cheek and ear. Do not consider gasping to be normal breathing. If the person isn't breathing normally or you aren't sure, begin mouth-to-mouth breathing.
So check the airway by tilting the head back and listen for breathing.
Exactly, but now B equals breathing, breathe for the person. Rescue breathing can be mouth-to-mouth breathing or mouth-to-nose breathing if the mouth is seriously injured or can't be opened. With the airway open, using the head tilt chin lift, pinch the nostrils shut for mouth-to-mouth breathing and cover the person's mouth with yours, making a seal. Prepare to give 2 rescue breaths. Give the first rescue breath, lasting 1 second, and watch to see if the chest rises. If it does rise, give the second breath. If the chest doesn't rise, repeat the head tilt chin lift and then give the second breath.
So, if not breathing normally, pinch nose and cover the mouth with yours and blow until you see the chest rise. Give 2 breaths. Each breath should take 1 second.
Yes, now C equals circulation. Restore blood circulation. Check if the victim's heart is beating. In order to do that, find carotid artery. It is located in the depression between the windpipe and the neck muscles. Place 2 fingertips on it and apply slight pressure for several seconds. If no circulation is detected, begin chest compressions.
Although that's mean compressions.
It does, my friend, very observant. C equals compressions. After 30 compressions, tilt the head back and lift the chin up to open the airway. Prepare to give 2 rescue breaths. Pinch the nose shut and breathe into the mouth for 1 second. If the chest rises, give a second rescue breath. If the chest doesn't rise, repeat the head tilt chin lift and then give the second rescue breath. That's one cycle. If someone else is available, ask that person to give 2 breaths after you do 30 compressions. Place the heel of one hand over the center of the person's chest, between the nipples. Place your other hand on top of the first hand. Keep your elbows straight and position your shoulders directly above your hands. Use your upper body weight, not just your arms, as you push with 2 hands straight down on the chest 2 inches deep. Push hard and push fast. Give 2 compressions per second, or about 100 compressions per minute.
So, if the victim is still not breathing normally, coughing or moving, begin chest compressions. Push down with 2 hands 2 inches 30 times right between the nipples. Pump at the rate of 100 per minute, faster than once per second.
Correct. I think you are ready to practice some role-playing. Show me how to use the ABCs of CPR and first aid. Now, for the next 15 minutes we are going to work in groups while partners observe each other demonstrating the skills learned. Peers will provide feedback for desired and undesired behaviors by raising hand for correct desired behaviors or pointing for undesired or improper techniques.
Okay, here we go. Hello, are you alright?
Good, you checked. Check for unresponsiveness and lack of breathing or abnormal breathing.
This person is not responding and cannot breathe. Call 911.
Great. Call and activate emergency response. Call 911.
Now I will push on the chest.
No. Wait.
You are right, dog. I need to see if they have a pulse. Now I can start CPR.
Wonderful, care. Perform 30 chest compressions, push hard and push fast in the center of the chest and give 2 ventilation and then alternate 30 compressions with 2 ventilations.
Thanks, dog. You're a great teacher.
Now, my friend, I think you are ready to finish with a final quiz. I am confident that you will do very well and you will be given 25 minutes to work.
I think so too.
Now that you have passed the test, we are going to close this day's lesson by provide each member a copy of the Pocket First Aid Kit instruction so you can have information at your fingertips. Divide it into groups and ask each group to demonstrate how and when they could use their Pocket First Aid Kit. Say, hi. 5. Stay alive every time someone comes up with a new method or situation for using the Pocket First Aid Kit according to the ABCs of first aid. And remember, the life they save could be yours.